Officer, and thank you, Minister, for your statement and sharing a copy in advance. And can I also put on record my thanks to the hard-working frontline staff in the Betsi Cadwaladr Health Board that do their best under very pressing circumstances to care for the patients who present themselves in various places across North Wales. I listened carefully to your statement. I also read the documents which are online in relation to the cycles, as it were, to try to monitor the progress. And I have to say, Minister, I'm disappointed that there was no reference whatsoever to the Ernst & Young report and any of the progress that might have been made in relation to the findings in that report. That report is still not in the public domain, in spite of the warm words from the Chair of the Health Board and the Chief Executive suggesting that they might be able to put a copy in the public domain, albeit redacted, at some point in the future. As you and I both know, that report made for very alarming reading. It suggested that people were guilty of the falsification of accounting documents, false accounting, potentially misconduct in public office, and certainly the inappropriate awarding of contracts without due process in collusion with an NHS supplier. And that supplier, it's come to my attention, Lightfoot Solutions, is actually working with 6 NHS bodies across Wales with contracts worth £10.63 million, which is, a not insignificant sum of taxpayers' money. And I want to know what work has been done to seek assurances by the Welsh Government that those other contracts were also awarded in the proper way. Because Audit Wales have recently corresponded with me about not just the financial accounts for which the findings of the Ernst & Young report related to, but the previous financial year, 2020 to 21, and they identified that there was also a 1.2 million contract which was accrued for in those accounts with Lightfoot Solutions. It was not identified because the figure of 1.2 million, which is in the account, was split into 2, so that it was just below the threshold by which the auditors would have looked at it, which, of course, in that particular year, I'm led to believe, was £1 million. So it's quite clear that there's been a deliberate attempt over 2 years to hide some of these issues from the auditors, and I want to know a little bit more about what the Welsh Government's doing to scratch underneath that and determine whether it's going on elsewhere. You also didn't refer in your statement to NHS Shared Services Partnership. We know that they were involved, or that a senior person in that organisation was involved in preparing a document, a purchase order, which was designed to fail in order that a contract could be awarded. Clearly, that is a serious thing. And I want to know what's being done to hold that individual to account, and indeed all of those individuals who were implicated in all of these things. Now, that report was published in January of this year. We're now in September. We'll soon be in October. You say that there's been quite a lot of churn in terms of the leadership. Obviously, we've seen the churn with the board. We've seen some changes in the executive team. But I've not been made aware of anybody being sacked for what happened. I'd like to know if anybody has been sacked, whether these disciplinary things are still ongoing, if those people who have left with large golden goodbyes, and I certainly hope that they haven't, because the public want to know these things. So, I appreciate that you've talked a lot about all sorts of things, and it was a long statement, but we haven't had any answers in respect of any of those particular issues. And, you say that real progress is being made. There are signs that the Health Board is making progress on some things, and I'm glad to hear that. But we have heard it all before. We've had false starts, many of them, over the past decade with Betsi, and unfortunately, in the end, they've all amounted to nothing, because the leadership in the Health Board hasn't been there in order to really drive through the change and deliver the stability that the organisation needs. In terms of the situation with the coroner's recent findings, we see these coroner reports come time and time again. There are common themes to them. So I'm pleased that you're wanting the organisation to be more of a learning organisation. But there are many things which don't get to the coroner that hit our complaint inboxes that we raise with the Health Board that take way too long to get responses to on behalf of our constituents. Up to 9 or 10 months sometimes, just to get a simple response to what appears to most of us to be a straightforward complaint. Now, clearly, if you're not able to investigate and respond to those things in a timely manner, then you can't learn from them in order to put things right in the future. So can I ask what work is being done by the Welsh Government, with the Welsh Government support at the Health Board, in order to improve the turnaround of the ordinary day-to-day complaints that are received, not just these big reports which shine a spotlight on some of these common themes? I know I've got to wrap up, but it was a long statement, Deputy Presiding Officer. I appreciate it. Can I also ask that, I listened carefully to what you said about the visits. I'm pleased that you and the Deputy Minister have made visits and identified some of the problems in mental health care. It astonishes me that there was still some work to do in some of the units around patient safety. I've visited them in the past, pointed out things, they've said that they'll be sorted, and yet here we are years later, and there were still some immediate safety concerns. So how are you going to ensure that, even though you've shone a spotlight on them, they're actually delivered in terms of improvements? And just finally, if I can ask this, you referred to these payments being made to the Executive Director of Nursing and Midwifery, over £400,000 a year at the annual rate of pay. Her appointment took place at a time when this Health Board was in enhanced monitoring by this government for its finances. How on earth was that able to happen under your Welsh Government's escalation framework when it was in enhanced monitoring? It begs the question as to whether your monitoring arrangements, whether your escalation framework is fit for purpose. So will you commit to reviewing that escalation framework, because it clearly hasn't worked in respect of Betsi at all over the past decade, and especially the financial aspects of it, given what we know has been happening in this Health Board and what we know happened with this particular person's pay? Thank you.